Let me, first of all, thank your viewers for sending in these questions. Indeed, earlier this morning, we did our best to answer a good number of the questions. We are also shortly going to make available some online platforms that people can ask more questions. But I really appreciate what you are doing. You would recall that prior to taking a decision to impose restrictions on some parts of the country, I think about, all about 40 MMDAs, the president took his time. And it's because the science tells us quite clearly that imposing restrictions only, without more, only delays spread if indeed you have elements of the virus in the community, and now we believe we do, and that by the time you lift it, then it continues. So imposing restrictions must be coupled with a more substantive action, because imposing restrictions only allows you to buy time, but you must do something with that time. Yes. So the substantive work which we are doing within this imposition period is enhanced surveillance and testing. Now, why are we doing enhanced surveillance and testing? Traditionally, many countries have been chasing the virus. So it's when you have a case, then you contact trace around the case, and then you try and resolve that one, and before you realize you have another case, you are chasing the virus. If we're going to be successful in this enterprise, we have to go ahead of the virus and rather go in search of it and contain and try and flatten the curve and literally deal with the situation. To do that, what we have to do is to restrict some movement, yes, which naturally delays spread, but gives us an opportunity to ramp up surveillance and testing of a number of cohorts. So in Ghana today, we have about 54 or so cases. If I just may check the data sets, we have about 54 or so cases that came out through the general surveillance.